Achilles tendonitis, this you gotta get early, and you must listen to your Achilles when you start to feel any kind of problems here, because if you start to set up a chronic scenario where it's long-standing and you've had it for weeks and months, it's really hard to get rid of. Whereas if you get it in its really early acute stages, you can often get it right. Because I know I've seen lots of people that have had Achilles for years and just can't get it right. And that's why I say, for me, this is one injury you must listen to your body and make sure that you treat it right. So as soon as you feel any kind of inflammation within your Achilles, and that will present as pain, that will present as a bit of thickening usually, or the first stage will be pain. Then you'll start to see a little bit of thickening. And if you get somebody to have a look at you from the back, you'll see a difference. Your left Achilles and your right Achilles, one will be thicker than the other. So I think from that point of view, you must, it will be very obvious straight away that you've done something. And then it's quite important that you go into your principles of protecting it, resting it definitely, so coming off the activity that you were doing. Ice. Compression's a lot harder when it comes to an Achilles, so I would generally, yes, I might use an ice and compression machine, but it's really getting ice, getting that kind of, getting the inflammation starting and then getting rid of it. So that's the thing with the early stages there. So compression not so much, and elevation. Again, elevation will have a little bit of effect depending on how much swelling you've got. So straight away, ice is the thing. That's what you want to be looking at to try and calm everything down. Now the problem is, every time you walk around you're going to use your Achilles. So what you have to do is monitor your activity levels, especially going up and down stairs and things like that. You're going to make it even worse. And what you need to do is listen to your body again. So if it keeps swelling up, you're still doing too much, and you've got to calm right down. So that's what I would do in the early stages. Again, in terms of any other treatments that go with it, you would use ultrasound, I would use laser. And in terms of massage, you can do some kind of friction massage, where quite often when it gets injured and you get this kind of thickening around your Achilles, you'll get this kind of, it feels like crepitus, it feels like little bits of stones that are around it, and you can just massage those a little bit to break those up. If you do it too hard, it's too painful, so you generally won't push it too much. But you can do a little bit of massage fairly early on with that. But the first thing you must do is rest it and actually don't touch it, and leave it, for me, let it just settle. Once it's settled and the acute stages have gone, where it's that real sharp pain that you get within it, it's getting better and better and better. And even though it might still be swollen, most of the pain might have gone, that's when you then start to think about putting some load through it. Now, very similar to a calf strain, you're loading it every time you walk. So I wouldn't necessarily look at any other kind of strengthening apart from doing some eccentric work. And eccentric work, basically, when you're going to lower down, so you're going to do a calf raise, a normal calf raise, but it's the lowering down aspect of it that is very important, because that gives some tensile strength into your Achilles and gives it so it can withstand load. Because if you're walking, your Achilles has to sustain so much of your body, so many times of your body weight, and the same thing when you run, it's even worse. So you must be able to withstand that load. So for me, it's quite important that you start to do the eccentrics once that acute stage has settled down. Keep looking at the swelling, keep looking at the pain. If both of those are okay, just keep ploughing on and do more and more of eccentric calf raises. Eventually, as I say, you want to be looking to do, if you can, sort of 180 a day, which sounds a lot, but actually you need that amount of load to go through it. And it needs to be done in that kind of controlled manner as an exercise. And as I say, over a period of time, you will slowly notice the swelling and the pain to decrease. And then you just carry on those exercises throughout. So outside rehabilitation for an Achilles, what you're really looking for is, are they going to react? There's nothing for me specific. It's not like jumping is going to cause it particularly. It's not necessarily that they're doing this activity or twisting or turning. It's going to be the amount of work, and it's going to be, can the sportsman or the player withstand that amount of work? So this is one of those scenarios where actually I wouldn't do a specific rehab session. I would just go out and do a session which had enough duration to it so that at the end of it, have you got any pain either during it, have you got any pain straight after it, or have you got any pain the next day? That's when I'd look and think, okay, it's not quite ready, as opposed to thinking I need to do that particular activity or that particular activity. Because often walking and jogging are one of the hardest things to do with an Achilles, especially when it has been inflamed and it has reacted. So, you know, that's going to be your biggest guide, to be honest with you.